So this is Dr. Bhavana, Parikh, surgical oncologist from Ahmedabad. I'm working at Anamay Cancer Hospital, and I'm just going to give a brief review about a common curable cancer into women. Today we will be discussing these cancers: breast cancer, cervical cancer, ovarian cancer, uterine cancer, vulval cancer, and vaginal cancer. So to begin with, breast cancer. If you look at the incidence of breast cancer in USA, it is 1:8. I mean, among 8 female, female is definitely going to have a breast cancer. This is an old data. Maybe this incidence has increased over the period of time. If you look at the Gujarat, my own area, where the cervical cancer is the highest one, and the breast cancer is also, I mean, couple of years in last couple of years, the breast cancer is also touching to cervical cancer. So these are the two main cancers of Gujarat. I think probably the condition of India is also same. So what is a breast cancer? So breast cancer is, I mean, what is actually the breast? Breast is, this is an organ in younger females when they are in a reproductive age. This is actually the breast tissue is, it open, these are the ducts, these are the lobules, and the ducts open into a nipple, and the breast cancer actually originates at this area. So this is a cell lining of a breast duct. If there is any change into a size and shape and numbers of these cells because of any stimuli or any kind of etiological factors, breast cancer develops. This is a fat area. As the age advances, this breast tissue decreases in the size and the fat tissue increases because of the post-menopausal condition and hormonal changes. But from outer side, it looks almost same. Maybe because of the obesity, its size may increase, but from outside, it doesn't make much changes. So this is how the breast cancer developed into these ducts. And now we are getting many a time questions why the breast, when there is a tumor into breast, when it goes to, why should it go to the vertebrae, why it should go to the bones, why it should go to the lungs and livers and all that. So these are the lymphatic channel actually which spread tumor cells to one area to another area. It first goes to the axilla. 85% of the tumor cells first goes to the axilla, then neck, then this internal memory chain of nodes, and then from here it goes to lung, liver, brain, and other parts. One of the risk factor for breast cancer, I mean, if any patient asks what is the reason why I developed the breast cancer, then there is not a single cause responsible for the breast cancer. It is it a hereditary? It is hereditary in 5 to 10% of the patients. It can be a genetic one also, and 70 to 80% is because of the today's lifestyle. There is no reason to happen to this tumor. There is no this percentage of the patients. Even there is a no history, family history of the breast cancer also. Other risk factors are having a high fat diet, non-vegetarian food, especially the red meat, high carbohydrate diet, junk foods, smoking, active smoking as well as the passive smoking. Increased risk factor for the cancer is not only for the breast but also for the lung, colon, rectum, breast, endometrium, and the prostate. Other risk factors are patient is either taking a OC pills or hormone replacement therapy post-menopausal, or she is taking a hormone replacement therapy for the infertility. So these are the induced hormones, exogenous estrogens, which is responsible for this tumor. Not only for this, but also for the ovarian uterine malignancy also. Non-lactating mother, either she is single, married, but not having kids, having kids but cannot lactate her because of the any reason. This is also one of the risk factors. So lactation is one of the responsible thing for prevention of the breast tumor, breast malignancies. Alcohol is also one of the risk factor for breast cancer. So which are the symptoms for the breast cancer? It is a small lump or a large lump, which is a painless lump. There is no pain at all, but a patient can feel the tumor. We routinely see 4 to 5 centimeter of a tumor in our day-to-day practice, but it can be smaller than this if we do a screening mammograms. And there is typical presentation of a painless lump into the breast, anywhere, any quadrant of the breast. It is so it can be a malignancy, but not always it is a cancer. Other symptoms are like having a lump into the breast, having a swelling into the axilla, any kind of changes into the contour of a breast, nipple discharge, or the nipple excoriation, and the retraction or puckering of a needle. So any of these symptoms or sign can be of a sign of a breast cancer. But even if this sign or symptoms is there, it does not mean it is a malignancy. Patient, it has to go for biopsy, which rule out whether it is a benign case or malignancy. This is a photo from the Google, but it is not uncommon in our practice. If you look at this photo, this entire red area is a cancer. It has totally eroded the nipple. Actually, there is not much of the nipple left in this. These all are called as a satellite nodule. These all red patches are called as a satellite nodule, or if you take a biopsy, this may be a positive. Look at this axilla. It has got a big node from here to here. It is a fixed matted node. By looking this photo, you can make out patient can be into the stage 3 or 4. If you do investigation in this patient, either in terms of after biopsy, if you diagnosed and if you do any kind of a investigation, this patient like CT scan or PET CT scan, patient definitely will be having some metastasis into the rest of the other part of the body. So this is a quite a common, not common presentation, but we do routinely see such patients also in our day-to-day practice. This is the comparison with an orange. The way orange can be can get bad in her shape, size, and can get wasted. This you can compare with your breast. So just take care of. It is like a fruits, so it should not create much problems. So many a time patient asking why my breast tumor gone to bones, liver, lung, how it spreads. So this is a photo which shows you how it spread to the other part of body. Suppose there is a tumor over here. There are green colored lymphatics. They are very microscopic lymphatics. You cannot see it by naked eyes. From here it goes to the nodes, which are called as axillary nodes. These are the green nodes. These nodes are actually present in everybody's body, but when they carry the tumor cells, they become positive. From here it goes to the neck nodes. We call it as a supraclavicular nodes. Sometimes the tumor from inner side goes to these places. This is called the internal memory chain of a nodes. So this is how it spread within the vicinity of a breast. But from here, when the patient still it goes, it spread beyond this neck, axilla, and breast. It can go to the brain, it can go to the lungs, it can go to the liver, and it can go to the bone. This photo is totally a picture of a stage 4 breast cancer. One of the most important investigation tool to diagnose the breast cancer is a mammography. Mammography is basically two photos of one breast. One is upside down, another is a side-to-side photo. We have to keep the breast in between the two plates, and we have to press it as much as possible so the entire breast is being covered into this plate. One more is a side-to-side photo. So there are two photos of each breast. So there are 4 photos of mammography breast and the mammography of a breast. So this is how we can screen the breast tumor. And patient those who are more than 40 years of age requires mammography. Those who are less than 40 years of age, we do sonography. Sometimes we combine with the sonography and mammography both. It is called as a sonomammography. Depends how the patient's breast is. So what is the treatment available for this kind of a breast cancer patient? If it is a very small tumor, T1, T2 or an early stage tumor, we generally remove the breast tumor along with the margin, and we remove the axillary nodes, or sometimes we do sentinel node biopsy according to the axillary nodal status. Previously, we used to do mastectomy for all the patients, whether it is 1 centimeter, 2 centimeter, or 3 centimeter. But the concept over the 10, 15, 20 years has been changed. We don't remove the entire breast for the very early stage breast cancer. We conserve it like this photo, and the remaining breast has to take a radiotherapy treatment. So this is how the treatment has evolved over a period of times. Breast conservative surgery. This is a clear, very nice photograph of the breast conservative surgery. This is a tumor. The tumor is being removed along with the good wide margins, and these are the axillary nodes. So it has to be either sampled by doing sentinel node biopsy, or it can be removed by axillary lymph node dissection. So the rest of the entire breast is being saved, preserved, and this entire breast will take radiation treatment. So if you don't do mastectomy and do this treatment, it is very well good, acceptable with the very good results. These are the couple of the photos of my own surgery. This is a tumor which having a right upper outer quadrant of a breast. We have done a breast conservative surgery, just done a cosmetic surgery along with this. So it gives a clear, good shape of a breast contour. Axillary nodes has been removed. We keep a drain just to remove all the wastage fluid to come out, either blood or by serum or any other thing. And the remaining breast has to take a radiation treatment compulsorily. And this is one of the patients where the tumor was in this side, upper outer quadrant. We removed the tumor along with the axillary lymph node dissection. This is a photo of a mastectomy patient. If you look at this photo, this place, I mean, this side look like a flat chest, like a male chest. So this is, if you do breast conservative surgery in early breast cancer patient, this actually change the perception of the patients, and patient feels good without removing her breast. Male breast cancer is also there. It is quite uncommon. It is only 1%, but when it develops, it is always, we see patient with the later stage. So what we can do to diagnose any breast tumor, whether it is cancerous or not cancerous in our own body. So this is called as a breast self examination. You can get many YouTube videos and Google images of this. It has to be done in a very correct way. Remove all the clothes, stand in front of a mirror. Check the size and shape of both the breasts just by looking at it. Check the position of a nipple, skin over the breast, any bulging anywhere, kind of a dimpling of a skin, nipple retraction. See, any swelling in the neck can be visible. Axillary swelling is visible from outside. Then just raise your both the hands and check the nipple position again, whether one is lifting up and other is not lifting up. So check it that any dimpling into the skin or any swelling to the axilla. So this is how, just by the visual inspection is by. Breast examination by palpation can be done in two methods. One is by supine position. It should never be done in a sitting position by pressing the breast by upside down. You have to just lie down, let the breast to relax on the chest wall, and make it on the clockwise position, and just press it slowly by your just palm, so it can detect any kind of a tumor into it. Sometimes in a younger patient, the breast tissue feels like a tumor. So once you check daily or weekly or monthly your breast, you can make out your own breast texture. Then after, you can diagnose any kind of a tumor into it. Another method is by taking a bath. So when your hands are wet, you can, your sensitivity increase, so you can palpate it very well. Palpate it gently, check it thoroughly, don't press upside down, so otherwise your breast tissue will be punched in between. I mean, breast upper plate will be pressed with the lower plate, so you cannot see it properly. Cervical cancer, another most commonly diagnosed cancer into females. There is a competition between the breast cancer and cervical cancer. One is sometimes higher than the other, depending upon your country, in which continent you are staying. But in India, if you look at every 7 minutes, one Indian woman dies of a cervical cancer. It is a highly preventable disease. So, what is a cervix? What exactly the part is cervix? This is a female reproductive organ. This is a uterus. This is a lining of a uterus. We call it the endometrium. These are the ovaries. There are two ovaries. This is a fallopian tube, and this portion is called as a cervix. This is a vagina where the menstrual blood flow comes out. One of the most common risk factor for the cervical cancer is a human papilloma virus. It is very commonly sexually transmitted virus. More than 100 or more than 140 types of HPV virus is there. A couple of the variant has been diagnosed. Those who actually do a cervical cancer, once it enters into a skin or into the cervix, it makes a replication over there, and 90% they heal within the 1 or 2 years. But if it is, but the infection persists or they spreads more, or then it will develop into a cancer, but takes around 10 to 30 years to develop this malignancy. So you can prevent this tumor somewhat here also. So it is a very easily preventable disease. Now the Indian government is also coming with a very cheap Indian made vaccination. If it is vaccination is done very well, then we can at least prevent this cervical cancer. I mean, incidence of cervical cancer will automatically go down. One of the most common cervical cancer symptom is postmenopausal bleeding, or there is a pain or bleeding after intercourse, or there is some abnormal vaginal discharge, or there is a heavy menstruation blood flow. Rest of the other symptoms are depending upon your stage of a cervical cancer. So this is how the cervical cancer we see it. Like this is a normal cervix. This is a low grade CIN. It is a highly curable condition. High grade CIN again a curable condition. And cervical cancer in a very early stage is also, uh, I mean, it is a curable condition. But this entire cycle takes sometimes many years. So we can diagnose a normal cervix, low grade CIN, high grade CIN, and these also. It is just a simple office procedure to examine it, just like a antenatal checkup. Very experienced gynecologist, gynecologist, or any surgeon who has got a good knowledge about the cervical cancer can palpate it just by putting your finger into vagina. Sometimes it is a bimanual examination, and we inspect this portion by a special instrument. We do pap smear or liquid-based cytology also to diagnose, and if it is a tumor, a biopsy has to be taken. This is a pap smear, quite an old method. This is how we see. We put an instrument over here. This is called as a Cuscos forceps. We see this by light, and just put a swab over it. I mean, we move it clockwise and put it on a slides, and this is called as a pap smear. One more investigation, which is a highly recommended, it is called as a liquid-based cytology, where we use a brush instead of this swab. We take a special kit, and it can diagnose even a single cell of a tumor also. Very early stage, we do leap excision by just cutting it with the wire. Very early stage cervical cancer can be treated with this way, but which is early CIN can be treated with this way, but early cervical cancer can be treated with the Vardhami hysterectomy. We remove uterus, both the ovaries, fallopian tubes, vagina with a good 1 centimeter margin, and also with the lymph nodes. So this is a slide which show the staging of cervical cancer. If you look at the first row, this is a stage 1A1. This is a 1A1 or 1A2, and this is a stage 1B1 and 1B2. This slide, these patients are can undergo surgery. Rest of the other, even if it is a stage 2 and 2B, they should go undergo chemotherapy radiation. Even this also stage 1B, this none of these patients will undergo surgery. So cervical cancer actually unfortunately come in either stage 2A, 2B, or 3A. Sometimes 3B also. Previously we used to see with the 3B also. But because of the screening procedure and all, we are now seeing the earlier stage. But only this row, stage 1A, 1B, 1B2, we can operate this patient for cervical cancer. Patient those who cannot undergo surgery, the next treatment is radiotherapy along with chemotherapy. Radiotherapy is just like a CT scan machine, but it is has got a high radiation. I mean, radiation which is a therapeutic means, and the radiation can be delivered under the imagination of a CT scan. So this is how the radiation treatment can be. So our next cancer is about ovarian cancer, and this is a female reproductive organ. It's in uterus. It is in uterine linings. This is a cervix, and these are the ovaries, right and left. If you see any kind of a tumor over there, it can be either cancerous or non-cancerous, but this is basically an ovarian tumor. So this is how it look like. Which are the risk factor for the ovarian cancer? Number one is obese. Obese patients are more likely to get this malignancy. Smoking, along with the alcohol or without an alcohol. Age of more than 50 years and family history of having a ovarian cancer or a breast cancer or any other cancer. So, cancer of ovary incidence is rising day by day. Previously thought to be 1 in 70 women will develop ovarian cancer. One of the tumor marker, which is CA125, it is just a blood test. Many of the health checkup or the cancer screening checkup, they enroll this test in their investigation. This can also shows if it is more than 35. Not always it is a cancer, but it can also raise your suspicious towards any ovarian tumor or ovarian malignancy. Signs and symptoms of ovarian cancer. It is an abdominal cramping or bloating, sometimes loss of appetite and back pain. The other symptoms are also available depending upon the patient's stage. In a advanced cases, patient may need to urinate again and again. Trouble eating while fulling quickly because there is a lot of fluid collection inside the abdomen. Pelvic or abdominal pain and the bloating. Early satiety also. Ideally, it should be diagnosed in stage and one and two, but unfortunately, we get a patients when it patients the abdomen is bulging. Many of the patients in a postmenopausal condition they think that it is because of the obesity or the pregnancy and all that thing, but it is actually the fluid inside the abdomen. Sometimes we drain around 3 to 4 liter of the fluid to diagnose this thing. So routine, I mean, commonly we diagnose ovarian cancer in stage 3A, 3B, or 3C. So this is how we see the bulging of the flex in case of ovarian tumor when there is a fluid inside. We call it is an ascites in our terms. When it is to oncologists, sometimes it is so advanced. You can see these all small tumor deposits all over the abdomen and also on the small intestine also. So this is normally naturally a stage 3 tumor, but if it has gone beyond the abdomen, it is considered as stage 4 tumor. So this is how it's spread in abdomen. Why? I mean, the ovary is just the lower pelvic organ. How it spreads from here, because there is a continuous fluid movement from here to entire abdomen. From the right side, it goes to the right pelvic area, the right paracolic girdle. From here, it goes to the right side of a diaphragm, just below the diaphragm, then the left side, and they move the entire abdomen wherever it they goes and the tumor settle down. You see the ovarian cells deposit. So this is how the pelvic organ disease goes to the upper abdomen. Cancer of uterus, vagina, and vulva. This is called as a uterine tumor. This is an uterus. This is a uterus, and this is a lining of a uterus. We call it is an endometrium. So this is also called as an endometrial cancer. Also, it is one of the good prognosis disease in the female reproductive organ cancer. The reason is it is diagnosed early because the hysterectomy is one of the commonest procedure done in India. And the second is there is a bleeding. There is a profuse bleeding, or sometimes there is a postmenopausal bleeding. So this actually automatically raise your eyebrows for either uterine malignancy or also the cervical malignancy. Any tumor, whether it is an endometrium, uterus, ovary, or cervix, it first goes to the pelvic lymph nodes. From here, it goes to the periaortic nodules, and then it spreads to other parts. It can go to the liver also, and it can go to the lungs also, and the other organs also. This is an image about the vaginal cancer. It is also majority will be seen with the HPV infection. If it is in early stage, we do operate, and if it is in advanced stage, we again give a chemo radiation. This is an image of a vulval cancer. This is an external genital area of a female, and this area is called as a vulva. Sometimes it is on the one side, sometimes it is on the both the sides. Sometimes it is involving the entire vulva, vagina, vulva also, vagina also, and many times it is also involving the urethral opening. The urinary opening also it been involved. Depend upon the stage. If this is a tumor, we can operate, but the other tumors, if it is in advance, we cannot operate. We have to give some treatment and we have to reduce it, and then we can operate. So vulval cancer spreads to, if it is a left sided, it goes to the left sided nodes. If it is a right side, it goes to the right side nodes. If it is on the both the side, it spreads on the both the side of a inguinal nodes. If the vaginal, vulval tumor is on the one side we do a partial vulvectomy or unilateral vulvectomy. But if it is involving the entire vulval part, sometimes with the pre-malignant condition, we do it as a radical vulvectomy. Not all the tumors in female reproductive organs are malignant or cancerous. Sometimes many a times we see fibroids. They are the non-cancerous. They grow very, very slowly. They takes many years to reach to 1 centimeter to 5 centimeter. If it is increase in the size, it gives rise to pain, sometimes bleeding. Also, in 1% case, it might convert into cancer. So, if it is symptomatic, has to be removed. Endometrial polyp can be a benign, can be a malignant, but if it is seen, this give rise to bleeding actually. So we can remove this by histoscopic examination and also remove it and we send it for the histopathological examination. If it is a benign, we don't do further. We can save the uterus. But if it is a malignancy, then we have to go for the second surgery for the uterus. So with this slide, I thank you very much and I conclude my presentation over here only.